Hi, my name is Amina and I'll be your nurse. We're going to be doing a head-to-toe physical assessment on you today. First thing I would do is go wash my hands with soap and water for 20 to 30 seconds, scrubbing all surfaces of my hands, including underneath my nails. Rinse my hands. Use a paper towel to pat my hands dry. Use another paper towel to turn off the faucet. Okay, so I'm going to provide privacy. Can you tell me, please, what is your name and date of birth?
1600, March 20th, 1978.
Thank you. Let me just check your wristbands. Excellent. Okay, and can you please tell me what year it is?
2021.
Who's the president?
Joe Biden.
What season it is?
Fall.
Thank you. And where are you located? What city are you in?
Providence.
Okay, so patient is alert and oriented times 4. All right. If you could please sit up for me. Okay. Have you been having any pain?
No pain. Yes.
Okay, and where is it located?
My shoulder.
Okay, and if you had to rate the pain from a scale from 0 to 10, what would you rate the pain?
5.
What makes it better, if anything?
Nothing.
What makes it worse?
Movement.
Okay, and can you describe the pain? Is it a stabbing pain, a dull pain, an ache?
An ache.
Okay, thank you. All right, can you please just raise your eyebrows for me? Frown. Smile. Puff out your cheeks. Thank you. Okay, so I'm just gonna go ahead and check your scalp. Okay, scalp, no, nothing abnormal. No bumps, lumps. Okay, so I'm just gonna take a look at your eyes. You can look at me, please. And just follow my pen. Okay. Okay, so pupils are equal, round, they react to light, and they accommodate. Do you wear glasses or contacts?
Yes.
Okay, so I'm just going to check your nose. There's no drainage. Nose is midline. Can you cover one nostril for me and just breathe in and out? And the other side. Okay, no drainage, looks good. Just going to check your ears. So I'm going to palpate the pinna. I'm going to pull the ear up and back. Check the tympanic membrane. Pull the pinna up and back. Okay, so there's no drainage. And tympanic membrane looks like a pearly gray color. Okay, so I'm just going to palpate your lymph nodes. Trachea is midline. I'm just going to check your mouth. Okay. Mucous membranes are pink, moist. I can see your tongue. Tongue is pink. One missing tooth. and no cavities. Lips are moist. And just to make sure, I did check the eyes. The conjunctiva is pink and the sclera is white. Okay, I'm just going to check your skin trigger. No tinting. Can you just squeeze my fingers for me, please? Okay, that's good. Allow strength equal. Push up on my hands. Push down. Okay, and can you just move your elbows for me? And check the range of motion at your elbows. And same thing with your wrist, both wrists. Move your shoulders up and down for me. Okay. All right. And have you had any numbness or any dizziness?
No.
Any coughing or shortness of breath?
No.
All right, so I'm just going to listen to your lung sounds. So breathe in and out for me. In and out. In and out. Take a deep breath in and out. Another one for me. Another one for me. And again. And one more time. Okay, let's just listen to the back. In and out. In and out. In and out. In and out. Again. Again. One more time. And again. Okay, so lung sounds are clear. And that's anterior and posterior. Okay, so I'm just going to have you lay back for me. In this case, we would have the patient lay sit up a little bit at a 45-degree angle. And if you just turn your head back to the opposite side, just checking for a jugular vein distension, which there is none. Okay, so I'm just going to listen to your heart sounds. So the first heart sound would be second intercostal space to the right of the sternum. And that would be the aortic. Second intercostal space to the left of the sternum. Pulmonic. Third intercostal space to the left of the sternum. Erb's point. Fourth intercostal space to the left of the sternum. That would be tricuspid. And And then fifth intercostal space, left midclavicular line. That would be the mitral valve. Once you get to the mitral valve, that's where the apex is. You listen to that for 1 minute. So that rate is a 88, and that's regular. So I'm going to check the bowel sounds. I'm going to check your abdomen, I should say. So first look at the abdomen. It's flat, round. I'm just going to palpate your hands, please. So the first thing I'm going to do is actually listen to your bowel sounds. I'm going to listen to each quadrant, starting with the right lower quadrant. And then I should be able to hear 5 to 30 clicks per minute. And I would listen to each quadrant for a minute. So that's the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, each one for a minute. If I don't hear the vowel sounds, then I have to listen to the quadrant for 5 minutes. And vowels are active in all 4 quadrants. And I would then palpate. Please let me know if you feel any tenderness. No tenderness? Patient reports no tenderness. So when is the last time that you had a bowel movement?
This morning.
Okay. And what color was it? Okay. And have you had any constipation or any diarrhea?
No.
Any vomiting, any nausea?
No.
Okay. And how about urine? When's the last time you urinated? Okay. And what color was it? Have you had any problems with the stream? Any burning? Okay. Any pain when you're urinating? Oh. Okay, so now let's go ahead and we're going to check your legs. Go ahead and put your feet out for me. Okay, so I want you to press against my hands with your feet. Okay, go ahead and lift your right leg for me. Put it down, left leg. Okay, thank you. And then we're just going to check for any edema by pressing in around the ankle and the shin. There is no edema, so that would be a 0. If there was a little depression, about 2 centimeters, that would be a +1. Then 3 centimeters would be like a +2. And 4 would be like a +6. Okay, so we're just going to check the capillary refills on your actually, before we check the capillary refills on your toes, let's go ahead and check the capillary refills for your fingers. both at the same time. Okay, so capillary refill is less than 3 seconds. You know, you do want to look at the hands, make sure there's no clubbing. Okay, and I also want to check the radial pulses bilaterally. And they are equal, and I would say that was a +2. Now I'm just going to check the capillary refills for the toes. Capillary refills less than 3 seconds. Okay, so if you can go ahead and sit up for me. And the whole time I was doing this, I did check the skin for any bruises, scars, pressure sores, none were present. Oh, if you could just go ahead and stand and walk for me. It's a couple steps. Okay, and gait looks good. All right, so I appreciate you, and that is my physical assessment head to toe. Again, my name's Amina. Thank you.